Hello, my name is Dr. Lilly. Today I will talk about core strengthening exercises. I will guide you through a very simple series of core strengthening exercises, and I'll start simply with figuring out where spinal neutral is, and then doing some deep abdominal breathing with transversus abdominis activation to energize the core, and then we'll progress to pelvic floor activation and glute activation, and do some bridging. Okay, so in patients who are very early in the rehabilitation stage, I like starting, in supine position, and that's actually laying down with face up. So you should lay down with no pillow, face up, with a knee bent position, and you should simply start by finding out where your spinal neutral is. To find your spinal neutral, you should actually arch your back all the way forward, and then make your back flat all the way back, and kind of imprint yourself in the surface of the bed or floor. So this is arching back all the way forward. It is anterior pelvic tilt, and then making back flat, completely flat on the surface, and imprinting on the surface is actually posterior pelvic tilt. So you should actually go somewhere in the middle, in neutral spinal position. In neutral spinal position, there's just enough space to fit the hand in between your back and in between the surface of the floor or a mat or a table or bed you're laying on. So you should hold that little arch in that position, and then start deep breathing. So with deep breathing, you should inhale through your nose and inflate your belly, and exhale through your mouth and pull your belly in. Okay? So inhale through your nose, inflate, your hand should go up, exhale through your mouth, flatten your belly, deflate, inhale, inflate, belly up, exhale, belly tight and flat. Inhale, expand, exhale, sink. So you should do 10 deep breaths in and out, just to practice deep diaphragmatic breathing, and to practice inflating and deflating your belly. So with exhalation, belly should go down, but on the top of it, you should actually tighten up the muscle and pull everything in, like you're trying to fit in a tight pair of pants. So inhale, inflate, and exhale, sink in and pull to fit in tight pants. Inhale, inflate, and exhale, sink and pull. So you should do 10 deep breaths with pulling belly in. Inhale, inflate, and exhale, sink, pull in. So once you feel confident with exhalation, pulling belly in, you should add the next step, and next step is actually bridging. The next step should be actually pelvic floor activation. I like adding pelvic floor activation in my patients who have some pelvic floor issues or urinary incontinence issues. So with this step, you will actually inhale, inflate, exhale, pull belly in, and then pull pelvic floor like you want to stop flow of urine. So inhale, inflate. Exhale, pull belly in and lift pelvic floor, squeeze like you're stopping flow of urine. So you should repeat this step 10 times. Inhale, inflate. Exhale, pull your belly in and squeeze pelvic floor like you want to stop flow of urine. So do this 10 times and progress to the next step. Next step is inhale, inflate. Exhale, pull belly in. Lift pelvic floor and squeeze. And lift your hips up in a tabletop position. So next step is inhale, go down. Exhale, pull, lift, hips up. Inhale, down. Exhale, pull, lift pelvic floor, lift hips up. Inhale on the way down. Exhale, pull belly in, lift pelvic floor, lift hips up. Once you get all those steps in line, you should do bridging 20 times. And you should do one set of 20 once a day. Thank you very much.